Good afternoon, everyone. I'm Allery McNiff-Daniels. I'm the Senior Communications Officer for Tufts Health Plan Foundation, and I'm delighted to welcome all of you to today's webinar. We'll be talking about the policy and advocacy grants that will be coming up later this year. Before we get started, I want to go over a few items to make sure that you can fully participate in today's event. The slide that you see now is a screenshot that shows you an attendee control panel. See if you can locate that on your own computer in the upper right-hand corner. You'll see there are a couple of audio options. You can join by computer speaker system or you can join by phone. To do that, you would select phone call in the audio pane, and then you'll find the dial-in information. We have more than 250 people registered for today, so we have muted the lines for today, but we do really want everybody to be able to participate. So please locate the question panel and think about using that to submit your questions. You can send them in throughout the webinar. We'll be watching and collecting them so that we can save them all for the Q&A at the end. It's important to note that given the participation that we expect today, we may not get to every question during the live session. We'll do our best, but if we don't answer your question, please know that we will be in touch with you to make sure that you get the information that you need. Today's slide deck, instructions on how to apply, and a copy of the letter of intent are available for download. You can find them in the handouts section in your control panel. If for some reason you can't get them there, you can visit our website and go to Grant Applications Resources, and you can download the same information there. And finally, and really most importantly, we really want to get your feedback on today's session. You'll get a survey tomorrow with a few short questions. We hope you'll take a moment to complete it so that we can think about how to improve future sessions to make them as worthwhile as we can for you. And now we're going to kick off the program. It's my pleasure to introduce Nora Moreno-Cargi, the President of Tufts Health Plan Foundation and Vice President of Corporate Citizenship at Tufts Health Plan and Harvard Pilgrim Healthcare. Nora, it's all yours.
Thank you so much, Allery. Welcome, everyone. And on behalf of our combined organization and the team, I want to say we really appreciate and value the time that you're taking with us to learn about how we're thinking about the work moving forward, and then to hear from you some of the ideas that you have. I want to start off by saying that now that we are operating as one, we made some very, I think, strategic decisions about how we would think about our work in the initial years. We wanted certainly to leverage the goodwill and the great work that we have seen from both heritage organizations, to leverage our relationships and our partnerships and to build on that work. And so moving forward, at least for the first 3 years, I just want to share with you that we will continue our focus on food access as healthy food, and then healthy aging. This idea of focusing on older adults. We think that this was strategic and smart. What did the pandemic show us? But that access to food was critical and essential, and that older people were the most vulnerable during this time of pandemic. And so as we think about our organizations and moving forward, this is the initial step. We wanted to open it up to the grantees from Harvard Pilgrim Healthcare and let them know that they are eligible year after year through an open grant-making process. I want to say that we will be fully operational in 2022, but wanted to start off by ensuring that you understood how we thought about grant-making and also hear from you any ideas that you might have for us. One of the goals that we have as an organization is to be relevant and responsive to the communities that we serve, where we do business and where our employees live. I think that we take that seriously, and so want to hear from you about those tables you believe we should be sitting at, those organizations that are doing great work, those collaborations that are seeing new and emerging work. We're really open to learning from you. we see ourselves in various roles. Yes, we are a grant maker, but we also see ourselves as a partner, an advocate, a catalyst, a convener, and in all of those roles, see it as important to be listening and hearing from our grantees and our potential partners about how to be better in each of those roles. I want to say that it is indeed a pleasure to hear for the first time and see the team together for the first time in public. And so without further ado, I want to turn it over to, I think it's Philip, right? Okay, just Philip Gonzalez, who heads our grant making. Philip?
Thank you, Nora. And welcome. I would like to add my welcome to everyone. Thank you for giving us time this afternoon and for joining us. We look forward to interacting with you. And just to build on what Nora was saying, we are already beginning to work side by side as a team. And so it's important for us to make sure that you understand that our goal is to really make this seamless for everyone in community. So the slide just gives you a sense of who we are. You have on this top row, and hopefully on your screen, you can see the four faces that represent the grant teams from both organizations. You'll hear from all of us today, and as well, you've already heard from Alri McNiff-Daniels, our communications officer, and Nora. Alri does play an important role for all of us on the staff, but also with our partners and grantees, helping us all be effective in our communications going forward. So really, we do want to make sure that we're leveraging the great reputation and work from both foundations. And so for us, it's really important that you have the opportunity to engage with all of us. And that is the purpose of today. As we've said before, we love to hear from all of you. And we'd like to start off today with a little bit of more sense from you. We appreciate the fact that many of you gave us initial questions when you registered for today. But we'd love to ask you this set of questions as a first poll. You can answer by selecting all that apply to you, and we'd love to know what brought you here today. We'd love to learn whether it was to learn more generally about the combination of the Tufts Health Plan Foundation and Harvard Pilgrim Healthcare Foundation. Is it to learn about the foundation's guiding principles, about the focus of older adults and healthy aging and healthy food, or whether it's much more specific to your interest in the Policy and Advocacy Grant Program, which of course we're going to delve into great detail today. So if you can make your selections, we will keep it open so that folks can respond. We're just a little over halfway in terms of the percentage of you that have responded, so we'll keep it open for a few more seconds. We're now at 3/4 of the way. Just a couple more seconds, and we'll see. We'll share with you what you've told us, and reflect a little bit on how that will help us today. We're at 81%, so we'll give another second for folks to put in their last selections. And we're closing the poll. And so the results are actually great direction for us, because I think we'll be able to satisfy. So 82% of you have selected more information, wanting to learn more information about the Policy and Advocacy Grant Program, and we're absolutely going to provide that today. Almost half were interested in learning about the combination. You will hear more about that as well. And then almost about 2/3 are interested in understanding the focus on healthy aging older adults and healthy food access. So we'll be able to provide you that information as well. So hopefully this is really well aligned. Again, we welcome your questions entered into the chat box, into the questions panel on the right-hand side of your screen, and we will be able to get to those questions as we get through today's webinar.
Great.
Sorry, I'll turn it over to Kimberly to walk us through this next slide.
Wonderful. And so I actually wanted to start by sharing with you something that you shared with us. And so when you registered to participate today, we asked whether you were familiar with the foundation. 26% of you said that you were new to Tufts Health Plan Foundation, and another 52% said that you were somewhat familiar with the foundation. And so given this, we thought it would be a good idea to start with a brief overview of who we are. So Tufts Health Plan Foundation is endowed with support from our parent nonprofit, Tufts Health Plan. Both the plan and the foundation have a shared mission, and that is to improve the health and wellness of the diverse communities we serve. And in terms of the foundation's vision, we really seek to support work that is honoring and supporting communities working to be great places to grow up and grow old. Our current geographic footprint includes New Hampshire, Massachusetts, Connecticut, and Rhode Island. And beginning in 2022, we intend to expand to include Maine, a state served by the Heritage Harvard Pilgrim Healthcare Foundation. And so I do also want to flag that we have supported organizations that sit outside of these states, but it is for work that is specifically benefiting communities within these states. And of course, the foundation is not just about grant making. We also have wonderful colleagues who sit and do the work of our corporate citizenship team. And so that really encompasses event sponsorships, volunteer opportunities, match drives, match programs, drives, and employee board service, and so much more. And so the foundation really does welcome this opportunity to speak with organizations about the potential partnership from both a grant making perspective and from a corporate citizenship perspective. And so as you've heard us talk about the focus of the foundation, some of you may be wondering, what exactly do we mean by healthy aging? And so while the plan offers products and services that are across the age spectrum, again, the foundation is really focused on healthy aging and now healthy food access as part of the healthy aging scope of things. And so it's not really a narrow way of thinking about health. It's not about healthcare per se. It really is about encompassing a wide range of areas that affect health, including community environments. And so what you see up on your screen now are those kind of upstream factors, or what you may have heard as social determinants of health. And so for everything from transportation and civic participation and engagement, outdoor spaces, and of course, community support and health services. And so that's where you see a really strong connection to the work of healthy food access. And certainly, we would be remiss if we didn't think about the social determinants of health as context for the work that we do. And I will actually turn it over now to Mike and Caitlin to share a little bit more about the context of today's environment.
Thanks, Kimberly. I'm Mike Devlin, and I'm happy to talk about access to healthy food and Harvard Pilgrim's experience in trying to solve some of the healthy food access issues throughout 4 states that we work in. But first, I just want to say that clearly healthy access to healthy food is a key determinant of health, and that Kimberly highlighted very well. In 2020, Harvard Pilgrim did about $7 million worth of COVID grant making. And it was interesting to see that one of the major sources of need that people were trying to address in their organizations and the constituents they serve was food. In fact, it was 70% of the grantees that applied for our funds wanted to increase access to healthy food. And the next most important thing, which was at 40%, was for PPE, personal protective equipment such as masks and gloves. So that just showed you how important food access was to populations in need. And particularly when it comes to older adult serving organizations, they were also part of the mix as well. So the pandemic has showed that communities of color and communities that experience that are disabilities, So communities with disabilities and communities of color were particularly affected by the pandemic. And that's not untypical during times of crisis. We know there's one interesting statistic that the pandemic showed during the past year, and that is the insurmountable increase in food access, 102% increase in food insecurity in Massachusetts alone in 2020, according to Project Bread. So even before the pandemic, though, there's always been food insecurity in older adult populations, and it's always around the range of 11 to 12% in the New England region. And New England is one of the healthiest parts of the country, and that's already an unacceptable rate. But communities of color, particularly older adult communities of color and people with disabilities, have double that amount of food insecurity. So somewhere around 22 to 24%. Finally, more than 50% of older adults who qualify for SNAP do not participate in SNAP due to communication issues, mobility issues, and technology barriers. So right there are some important policy and advocacy opportunities to work on. Now I'm going to turn it over to my colleague, Caitlin Sullivan, who will provide some examples of what Harvard Pilgrim has done in this area. So Caitlin.
Thanks, Mike. So throughout our grant initiatives over the past 10 plus years, Harvard Pilgrim Healthcare Foundation has supported upstream solutions and healthy food access programs that target, engage, and benefit low-income older adults and people with disabilities. Some community-led examples include strengthening the enrollment and access to SNAP and HIP for Massachusetts residents, providing culturally relevant, and we want to emphasize that, culturally relevant produce at an affordable price at mobile farmers markets, nutrition education and cooking for one classes for older adults that maybe are living alone, providing medically tailored meals for older adults with chronic illness like hypertension or diabetes, and providing healthy produce delivery for homebound individuals that probably were homebound before the pandemic. So as Mike noted, COVID-19 has exacerbated and exposed many socioeconomic barriers and systemic inequities, and addressing healthy food access remains a top need in communities in supporting older adults. We've also learned that taking a comprehensive community-led approach to addressing food insecurity is often a key entry point to building trust and to providing other wraparound services in areas such as mental health.
Thank you, Caitlin. And so, as Mike and Caitlin and Kimberly have shared, we've done quite a bit of reflecting on the lessons we've learned through the pandemic, on the information that communities across the region have shared with us, both in the pandemic and preceding the pandemic. And we've taken all of this to take a fresh look at the guiding principles that we have been using, and remarkably found that really what we've learned has affirmed that these guiding principles continue to be relevant and really are a pathway for us and for our engagement in communities. So you can anticipate and expect that these guiding principles are going to continue with us, and these are the kinds of topics, questions, and aspects that we find useful to engage around with all of you. So things like collaboration, including a focus on equity, the depth of the community engagement featured in your effort, the ability of your efforts to have an impact at the policy or system change level. These are things that our grant making has been guided by to date and will continue to be guided by going forward. Now, interestingly, folks seem to maybe be familiar with these guiding principles, because in the first poll we asked, the response rate around interest of these in hearing about the guiding principles was at about a third. So I'm going to guess that hopefully folks have heard these from us in the past. We'd like to ask you another poll now. I'll have Mike walk us through that one. Thank you.
Great, thanks, Philip. So the question for you all is, has COVID-19 impacted the policy agenda of your organization? So if you could take about 20 seconds to complete this, that'd be great. And we'll show you the tally. So about 10 more seconds. Great. So Kimberly, you'll do your magic of tallying everything. Excellent. Okay, so clearly 73% of you said that yes, your policy and advocacy agenda has been changed because of COVID-19. That's terrific. So you're in the right place here today. Thank you. Turning it back.
Thank you, Mike.
Sure.
So let's delve a little bit more deeply into the actual policy and advocacy grant opportunity that we want to discuss with you today. So, the policy and advocacy grant category is one that we've been supportive of for a number of years, and it has had tremendous impact and created a lot of opportunities in community. So we want to give you a little bit of the overview of the kind of the elements of what we look for in policy and advocacy grant opportunities. But ultimately, one of the messages we hope you take away from today is that we really want to engage with you to hear more and to learn more from you. And so we'll be making ourselves available, and I'll get to that in a moment. But the efforts that we've been able to support through the Policy and Advocacy grant making, obviously have had an impact on healthy aging now and have included healthy food access over the years. So while we're highlighting that today, that has always been a feature of our grant making in this category and in others. As I mentioned before, alignment with our guiding principles really dictates that efforts should be inclusive and should be engaging older adults, should really have a concerted effort to address equity issues, and in particular for communities of color, and collaboration for us is a cornerstone of effective work. The Policy and Advocacy grants really have featured two areas of work, sometimes joined together in one effort, sometimes separate within an effort, and those are advocacy. So working at the policy or system level to create changes that really would affect older adults in a beneficial way. That can include educating and informing decision makers, generating information, and creating greater visibility and awareness of an issue. And then also we've supported organizing. We know that the voice of older adults should be present as decisions are being made at all different levels. And so we are supportive of and have invested in organizing directly with older adults so that they can set priorities and promote policies that reflect what they would like to see come about in community. So oftentimes, the best way to illustrate some of these abstract concepts is to give you some examples of recent grants. So we'd like to do that now. We'll organize them by the states. And so on the slide, you can see the selections that we've made for each of the 4 states that we'll talk about. I'll start, Kimberly will follow, and we'll walk you through some of them. I'll begin with our recent grant in Massachusetts. It was just made last year to the Trust for Public Land. Now, the Trust for Public Land is a national organization that has a very vibrant and active chapter here in Massachusetts. And the grant we've provided is supporting their work in the Grove Hall section of Boston. Folks that may not be familiar with that neighborhood, it is predominantly consistent of residents of color and has been adversely affected by a number of issues, not just the pandemic. The support for the Trust for Public Land is a 3-year grant that's enabling them to have a more comprehensive and directed focus on engaging and organizing older adults, because there's an opportunity that the city of Boston is pursuing to redevelop an open lot that sits in the middle of Grove Hall, directly opposite the senior center, the library branch, and a local high school. Older adults are now going to be central in the design, the planning, and the use of that green space, which addresses their ability to be effective advocates, but it also creates bridges between them and the city government, as well as addressing the need for green space and the need for environmentally beneficial green space. So increasing the shade canopy and other things that are lacking in that part of Boston. So we're really excited about this grant. It really does focus on the organizing piece, but with a direct connection to policy decisions that are happening in the city of Boston and through the network of the Trust for Public Land, 177 other communities in Massachusetts that have Community Preservation Act provisions in place that will be learning from this organizing effort that's happening in Boston. So let me turn it over to Kimberly to give you another example.
Great, thanks, Philip. So in 2020, we awarded a 3-year grant for $225,000 to an organization called New Futures. They're a nonpartisan nonprofit that works to improve the health and wellness of all New Hampshire residents. The work that we're supporting is to enable New Futures to advocate for a balanced long-term care system in New Hampshire that will ensure access to high-quality supports and services. The fragility and imbalance of the system was certainly highlighted by the disproportionately high number of older adult deaths in nursing homes and assisted living facilities due to COVID. And so the pandemic really accelerated stakeholder conversations on rebalancing the system. And as some of you may know, the state legislature has a pattern of requesting data studies before bringing bills to hearing. And so New Futures Futures was really thoughtful in wanting to align their strategy with opportunities to advocate for long-term care funding with the state's biennial budget. And so New Futures also was proactively trying to address that data need by moving forward with some critical data analysis. New Futures is also the co-policy lead for the New Hampshire Alliance for Healthy Aging, the statewide backbone for healthy aging. And so they're really well poised to ensure that older adults are really focused and central to any plan going forward. This work and this grant actually complements some similar efforts that the foundation is supporting in Massachusetts through the work of another grantee, Community Catalyst. And so, Philip, do you want to share some more about the work in Rhode Island?
Sure, thank you. So the next grantee I'll talk about is the Senior Agenda Coalition of Rhode Island. This is an organization that's Rhode Island-based and Rhode Island-led. It is dedicated, it's mission-oriented and dedicated to organizing older adults statewide in Rhode Island to support them as they develop priorities and an advocacy platform for statewide issues as well as some local issues. The nature of their dedication to older adults, the ability to have deep engagement whereby the older adults that are part of this organization lead the priority setting and lead the advocacy, allowed us to take the opportunity to provide them with general operating support. So they have a 3-year grant to continue their work, and they have been very active on a wide range of issues, including things like transportation. They have led the advocacy to preserve and fund a free bus pass program statewide for older adults. They're also working statewide on rebalancing of the long-term services and support system in Rhode Island so that it hopefully is more favorable towards home-based care and aging and community. And then they've also been working on a variety of other issues, including the benefits folks that are existing with low income but are not Medicaid eligible are in need of. So really what they do is organize older adults and support them to build an agenda and then to become effective advocates. This grant really does demonstrate how our guiding principles lead us to provide support, and in this case, general operating support, because regardless of the priorities they set, we know their work is going to be focused on older adults. So that wraps up Rhode Island, and I'll turn it back to Kimberly to talk to the next example.
Great. And so we also wanted to highlight some of the work that's happening in Connecticut. And so End Hunger Connecticut is actually the only statewide anti-hunger nonprofit in Connecticut. They conduct outreach, public education, and legislative and administrative advocacy. They also operate a bilingual supplemental nutrition assistance program, or SNAP, call center. And so we ended up awarding them a 3-year grant for $130,000 to support the hiring of a SNAP advocate that's dedicated to older adults and really focused on developing and piloting a local community messenger program. And this would be rolled out across the state. This program would train older adults in peer-to-peer SNAP outreach with the goal of really building a cadre of community members and elected officials who are prepared to protect and advocate for federal and state nutrition benefits. Now, the system level piece here that we want to highlight is that the Community Messenger Program is about collecting community level feedback that was really geared towards informing what state actions are possible and some recommendations. It also happens to dovetail with the state's recent rollout of the Elderly Simplified Application Project. And so the state of Connecticut is really relying on EHC, their contracted partner, to analyze how changes in the SNAP experience for older adults can increase retention and reduce churn. And so hopefully this grant really helps highlight that connection that the foundation has always seen between healthy aging and healthy food access. And so, you know, these are just four of many grants that the foundation has engaged in and supporting the great work of grantees across the region. And so we hope that, the process that we use for due diligence for the grant making that we engage in is really centered around understanding the context for the work that organizations are doing and how they know that, again, that communities are prioritizing older adults and really having them be central to the way that the work looks and is executed. And so we really encourage and welcome conversations about the work that your organization is doing, especially during these times of rapid change. And we welcome these opportunities actually ahead of submitting any type of application. Part of that reason is to ensure that you have the information that you need to make a decision as to how to prepare the letter of intent, in the case of this grant program. It's also an opportunity to help us understand how your priorities and opportunities have changed due to the current climate. And as we've seen from the poll question that Mike ran, 70-something% of you are actually changing the way that you work because of COVID-19. So we know that there's changes afoot, and we really want to understand what that looks like. And so conversations like these are really ones that we value. And just to let you know, we do use Calendly to help us schedule those time blocks. And so what you see on your screen now are the links to our availability for both Philip and myself. And so one flag to mention as you guys are thinking about engaging, oh, sorry, Philip, did you?
I was just going to point out that I think we need to go back a couple slides to show them the Calendly link slide. Sorry to interrupt you.
Oh, I'm sorry. I see. My
There we go.
Computer has advanced on me. They just want you guys all to see a preview of what's to come. But so apologies for that. But so certainly you see the links there for the Calendly office hours. And just to flag for you, my availability is actually limited until June 25th. And that is because I will be transitioning from the foundation team to engage in some environmental sustainability work. So please know that Philip and I work really, really closely together, and he will be getting full rundowns of all the conversations that we have. And so please do see this as an opportunity to engage with both Philip and myself, in the coming weeks ahead of the letter of intent deadline. And so with that, I think it's probably really helpful to understand what some of the key dates are and the process and timing. So Philip, do you want to walk us through that?
Absolutely. Thank you. Thank you. And I just want to underscore what Kimberly was saying is that we are working closely as a team, Mike, Caitlin, Kimberly, and myself. So we absolutely encourage you to reach out to us. We want to hear from you. We would love to engage and want to make it as easy as possible. So please use the Calendly links, but also know that we will want to stay in contact with you throughout the phases of this process. So let me walk you through, however, the process and the timing for the Policy Advocacy Grant Program. So this is a program where we use a letter of intent first, which is a brief concept paper. It does not require a line item budget. It does not ask for attachments, but it allows you to construct and give us a sense of the idea, the initiative, the effort that you would like support for. Those letters of intent will be due through our CyberGrants online application system. We'll talk about that more in a moment, by the afternoon of Friday, July 23rd. We will then review those letters of intent and issue a number of invitations to the full proposal phase based on the letters of intent that have been received. We will be issuing those invitations to organizations by August 20th. So around that time, just about everyone who's submitted a letter of intent will know the outcome and whether they've been invited to the next phase. And we will also be available to debrief any that are not invited to move forward. So we're always willing to provide feedback and to listen to your ideas and understand them better. The full proposals that are invited would be due by October 1st. Our process does include a site visit, which allows us to get deeper than we can just from reading the full proposal. So we will schedule full proposals, schedule a site visits around the time we receive the full proposals, and that will allow us to engage with you and your partners and learn more. Our decisions and recommendations will be processed with our board during their December meeting, so organizations will know the outcome of the process on or before December 17th, with the grants being effective as of January 1st. So the other question that we get is about eligibility to receive a grant or to seek a grant, and wanted to provide a little bit of information about that. Excuse me. Organizations to use our system and to submit a letter of intent and ultimately a full proposal need to have a 501c3 status as designated by the IRS. Fiscal agents can be used, and we've certainly funded a great number of our grants through fiscal agents, so we're very comfortable with that arrangement. And so, you know, please understand that if you're not currently a 501c3 but are working towards it or have a fiscal agent, that should not be an impediment or a deterrence for you to participate in the process. If you're outside of our 4-state region and are looking to work in those 4 states, so it's Connecticut, Massachusetts, New Hampshire, and Rhode Island, you'll need a bypass code to enter into the system. So let us know. We can provide that bypass code via email, and that will allow you access to the system. We are not able to fund governmental agencies, so that's city agencies, state agencies, or federal agencies directly, but we have had them be close partners of efforts in a great number of grants. And so understand that there is the opportunity to talk with us about your effort, even if you're not able to directly apply, whether it's because you're a municipal agent, a governmental agency, or because you don't yet have your 501c3 status. We can certainly talk with you and understand your situation and provide some guidance. There is a full list of our eligibility parameters on our website, so please feel free to consult that for more detail. The other question that we get a lot, and I'll just answer it up front, is about the amounts that our grants typically range from. We don't have a set amount. Our grants typically range from about $35,000 to $100,000 per year for up to 3 years. And so we funded everything from a $35,000 1-year grant to a $300,000 3-year grant, and everything in between. I will say that the policy and advocacy grants tend to most frequently range in the $65,000 to $75,000 per year level. But again, what we suggest is that you take a really good look at the work that you want to do, the resources that we'll need to take to do it well, and then approach us with that information. So let me turn it back to Kimberly to talk a little bit more about cyber grants.
Great, thank you. And so, you know, often we get asked, so, you know, what are the brass tacks here? So how do you actually apply? And so you can access the letter of intent by going to our website, and that is www.tuftshealthplanfoundation.org. And as you'll see on your screen now, you can access either by clicking on the Apply Here link in the top right-hand corner of the page, or by going to Grant Applications and then selecting how to apply from the drop down. And then from there, you know, as you click on the appropriate link, so in this case for policy and advocacy, you'll be taken to a step-by-step instruction guide on how to apply. And again, please note that in the handout section of your control panel for GoToWebinar, you will see a PDF with a preview of the letter of intent and what those step-by-step instructions are. And so before we dive into the question and answers period, and so certainly encourage folks to chat in their questions to us using the questions box in your control panel there. I did want to turn it over to Caitlin to ask one final poll question.
Thanks, Kimberly. So we have one final poll question right on your screen here, and it is, where do you get information about grant opportunities? So please select all that apply. So directly from foundation staff on a foundation's website newsletter, on social media via a grants database such as GrantStation, sector news, so something such as Philanthropy Massachusetts or the New Hampshire Center for Nonprofits. Select all that apply. You can keep them coming in. Awesome, and Kimberly is going to give the rundown. All right, we got a great mix here, 86% coming from the foundation website. So that's great that our grant opportunities are right on the website. We have 42 coming directly from foundation staff, 25 from social media, 49 from our grants database. Great. This is super helpful, especially as we're living in this super digital world. So we'll make sure to have some great opportunities posted.
Great, thank you, Caitlin. And so again, I think we would really love to answer some of the questions that you have, and I will actually turn it over to Alri to help us with seeing who has chatted us some questions.
We do have quite a few questions. Before I ask some of the bigger thought questions, we have a request. Kimberly, could you chat in to the full audience the Calendly links? With the slide mix up, that slide wasn't up for as long as it could have been. So I think
Absolutely.
that was helpful. So we have a couple of questions here. Let's start with this one. How many projects do you expect to fund in this cycle?
So I can start, take a quick stab at that, but certainly invite Kimberly and others to chime in. So that's a great question, and we get it quite frequently. Our process is pretty dynamic. As you know, we fund across 4 states, and we are really trying to be responsive to what we hear from community. So while we have an understood limited amount of funding available for this grant round, we don't really forecast how many grants we can make because it really depends on what we receive. So we're looking forward to getting the letters of intent, looking at all of them very closely and giving them all full consideration. But it's a little too early in the process for us to be able to give you a sense of how many grants are likely to be made this year.
Philip, can you just give us an average number from year to year? I think that we can at least minimally say how many grant applications we get and then the ratio of those that we end up funding.
So each year is a little bit different. I would say we typically see letters of intent in the 60 range, or maybe a little bit higher than that in a higher year. This year might be that. It certainly was in the first half of the year. And then we're typically making between 6 to 12 grants in this category each year.
So the questions are coming in fast and furious. Can a current grantee apply? And related, are new groups treated differently from groups that you already know or fund?
That's another great question. I'll actually take the second question first. So, all organizations that seek funding from us are treated on a level playing field. So, grantees from past or prior years, certainly we know their work and know that they're of the work and activities that they're doing from their grant reporting, either in an interim capacity or a final capacity. And so it can certainly continue those conversations about how the work is evolving and what new funding would really help enable the organization to do within their focus communities. New organizations, though, are not at a disadvantage. We do not have a weighting system that you may have encountered with other foundations in terms of saying, oh, we really want to see you apply 5 times before we'll give you consideration for your work. You have full consideration from the very beginning with the letter of intent stage. I will also share that both prior grantees and new organizations to the foundation both start with a letter of intent to the foundation. So there is not a separate track where some groups are treated differently from other groups. And then the first question in terms of whether or not a current grantee can apply, certainly get in touch with Philip and myself and the team, and we can help walk you through where your current grant is in terms of its final wrap-up stage. But typically what we do is we ask that organizations only have one active grant at a time. So if you're engaged in work that is set to wrap up by December of this year, because the grant for this program would be starting for funding in 2022, you would be eligible to start an application with us now for work that's ongoing from 2022 22 and beyond. If you're in the first year of a 3-year grant, though, we unfortunately wouldn't be able to consider your letter of intent, but we do, again, would like to have a conversation with you about how maybe the work has been shifting or evolving, where you may see the need to potentially shift some of your existing funding with the foundation.
Thank you, Kimberly. And then we have a couple of questions about multi-state initiatives. I'm going to combine them. We have a question here asking if a multiple state initiative, for example, the 6 New England states, be appropriate for a cross-border policy change grant. And then the related question, would you consider funding a national organization's advocacy efforts that would benefit older adults in every state, including Connecticut, Massachusetts, New Hampshire, and Rhode Island?
Those are great questions. I guess I'll start off with the response. So if I can take the second question first, our guiding principles really do have us focus on community engagement and collaboration. So a national organization working across the region, we would definitely want to know who their local partners are, the level and depth of their engagement, the role that they play in setting local priorities, and the approach in order to understand that. So a national effort that would have some impact in the states would need to demonstrate that there's actual engagement locally with organizations that are based here in order to have that impact, and that's something that those organizations have prioritized. We do consider efforts that span multiple states in our region, and again, we're looking for evidence of the collaboration, the engagement in those states that focus on issues related to older adults, and the approach that they expect to take to create change. We know that our states are very different, having worked across many of them over the years, and so we really would want to understand how the strategy is being applied in states that vary quite differently, whether it be New Hampshire and Rhode Island, Massachusetts and Connecticut, et cetera.
I would also just like to add to the first question too about the national organization. I think Philip had mentioned a great example earlier with the Trust for Public Land. They are a national organization. They do have a strong presence here in the Boston area. And so when we were considering their proposal, we really got a sense of what their work was at that local level, with the understanding that there was this opportunity to share lessons learned at a much, much broader scale. So that is definitely part of that kind of systems level change piece to some of the policy and advocacy work that we are supporting.
Thank you both. So I have a question here, a very specific question for you, Mike. Could you please tell us again the number of older people who do not apply for SNAP who are eligible? And while you do that, I'm going to go on with a semi-related question. Where does food is medicine and/or local food integration with public health fit into priorities for funding?
So I'll just say very quickly, and then maybe I'll kick it to Philip. But in terms of the SNAP participation rate for older adults, it's just over 50%.
Thank you, Mike.
Mm-hmm.
Thank you, Mike. And I think others may be able to contribute to this as well. But food as medicine has been something that we have supported both at the local level, a food pantry in Gloucester that has really developed a model for working with their clients using a food as medicine approach, as well as now at the statewide level with a grant to the Center for Health, Law, Policy, and Innovation at Harvard Law School. They're the folks that are the backbone to the Food as Medicine Coalition and have worked on the state plan. So we recognize that food as medicine is an important approach to ensuring the health and well-being of lots of people, including older adults. And so that's something that we have been supportive of. But again, everyone that we funded has had to demonstrate their level of engagement, their approach to collaboration, and the approach and strategy that they're planning to take to create change at whatever level, whether it's a community level or whether it's at a statewide level.
Philip, I just want to add, because having the privilege of being able to look at some of these letters of intent, one of the things when we look at collaboration is this idea of existing partnerships versus later to be created partnerships. One of the things that we understand is that work that's done together is much stronger. And so if you're interested, we want to know that those those partnerships are authentic, are ongoing, and are something that you are already engaged in. We have been known to also give planning grants, and those fall into a very different category in that if it's something that it is an initiative or a policy that you want to undertake and have to formulate multiple new relationships, we would also consider those, but we need to understand, where you are in the process and how you know that that's an issue you want to pursue.
Thank you for that, Nora. I have a grouping of questions, and actually I'm going to pause for a minute because I do want to say the questions continue to come in quickly. We are going to do our best to give you answers, and a reminder, if for some reason we are not able to get to them now, we will make sure that we reach out to you after the webinar. So thank you for your participation, and now let me move back to, it's scrolling too quickly, so I'll start on this side. If older people are not the primary population served, is an organization still eligible? Related question. Our organization focuses on an intergenerational model whereby we foster collaboration between youth, adults, and older people. Would this approach fulfill the expectations around promoting healthy aging, where the older people are not the sole focus, but the focus is intentionally building a community where all ages can thrive? And there was one other question in here that was about older people. I think those two pretty much cover it. I can't find the third one. My apologies.
Yeah, thanks, Ellery, and we appreciate all the questions that are coming in hot and heavy right now. And so, in terms of thinking about the older adult population, we certainly would like to understand what the impact is to older adults, but by no means do we think that policies and advocacy work that is great for older people is not going to benefit all age ranges. It's actually the opposite, right? We know that policies and advocacies that work for someone who is 80 is likely to be great for someone who's 8. A very specific example here too, going back to the work of New Futures and the rebalancing of the long-term supports and services system. We know that older adults are a specific target demographic there, but it also really benefits people with disabilities, and that is of all ranges, all ages, excuse me. So we certainly do appreciate how widespread the impacts can be. Again, throughout the due diligence process, what we'll want to understand is how older adults might be helping inform what the work looks like, how that kind of community level engagement, again, going back to our guiding principles, is really informing a policy or advocacy strategy. And then on a similar token too, with the intergenerational question, we have supported intergenerational work in the past. Again, it kind of answers that the same premise of, what's great for youth can also work great for older adults and vice versa. And so helping us understand the context for the work and perhaps, how you might be thinking about bringing together an intergenerational type of program is great context for us to understand your work.
Thank you, Kimberly. I've got a couple of nuts and bolts funding questions, but before I get to them, I want to lift up two questions here. One of them is about the definition of underserved populations, and one of them talks about basically the climate that we're in right now and the growing recognition of some of the systemic racism that has held barriers in place, and so how we think about that in terms of our grant making.
It's a great question, and it really gets to the heart of what we as a resource provider care about and feel is important to lift up. So underserved is a term that I think has been used in a variety of instances, but we tend to think of it as how do we make sure that older adults have equitable opportunities to be healthy and to pursue their health and well-being. And so we look at particular groups that we know have experienced disparities that are systemic in nature, communities of color, immigrants, and others that are either not native English speakers or not native born in this country. Other communities that have been intentionally disadvantaged through policy decisions that affect their the way their neighborhood has been developed economically, or the way that they have opportunities presented to them within systems. We as a funder do not want to increase or exacerbate disparities. On the other, quite the opposite, we know that as a provider of resources, we have an opportunity and an obligation to make sure that we are focusing those resources where they can do the most good. So we do really care deeply about that guiding principle of equity, and we look for it in every grant opportunity that we consider.
One additional way to think about it in the letter of intent, just from a brass tacks perspective, there is a question on the letter of intent form, and again, you can see this through the preview in your handout section. There is a question about describing your community and your community needs, and I think that's an open text box field, excuse me. So we're not trying to pigeonhole you into describing your community in words or in language that don't seem appropriate or seem to fit with your community. So please take that as an opportunity to share with us what your understanding is of your community needs and priorities, and share information there. We've had grant seekers include statistics. They've included references to certain kind of current events that are happening with within their community that provides, again, context for why they're proposing a certain type of work. So please use that as an opportunity to help us understand, because there are many different communities that the foundation supports, and we are certainly, again, looking for those areas to improve equity.
Thank you both. Okay, so nuts and bolts kinds of questions. How many years of funding can we apply for? Will you award multiple grants in a region? Can you clarify the main funding opportunities or timing? And then there's a question here that I think has some embedded assumptions in it in terms of regionalism, i.e. grant making that would be happening in the western part of Massachusetts or in more rural parts of the state, as opposed to grant making happening in Boston. So I'll let you all take a stab at those as we approach the close.
Okay, so you might need to remind us of some of the questions, but the first one about duration of grants. Grants can be made for 1, 2, or 3 years. And to Nora's earlier point about planning grants, we've seen planning grants that we've made that are for 1 year, obviously with the expectation that folks would plan and then come back. We've also made 3-year grants for efforts that are fully developed, have partnerships in place, and know what their strategy and their objectives are. And so it's up to the organization and your partners to decide whether you're ready for a 1, 2, or a 3-year request.
Multiple grants in a region.
Kimberly, do you want to take that one?
Sure. The answer is yes. We do not pre-allocate. So when all of the letters of intent come to us, we read them all alongside of each other. So we do not siphon them and say, okay, here are all the grants that are helping the Springfield area of Massachusetts, or here's all the grants that are helping the North Country of New Hampshire. We actually look at all of the requests at one time, and we do not say, okay, here's how much we have left. There's no quota for any particular region. So depending on kind of what comes into the foundation during a particular grant cycle, we may see just by a volume, a higher concentration of requests in particular areas. But the foundation really does try to think broadly across all of the states that we serve in terms of how our support can really help communities with their healthy aging and healthy food access objectives. The other way to think about it too is that we do not kind of elevate one particular region over another. And so there are certainly opportunities for multiple grants to benefit a region. We just certainly would like to understand, again, what the work is and what the opportunities are for policy and advocacy specifically, as that is the grant program we have in front of us.
Awesome. And then the one that we didn't get to is clarify, the question is clarify grants for Maine. So I presume that's a timing question that they'd like clarified?
Yes, we'll be opening the opportunity for grants to Maine in 2022.
I think that's all we have time for. We have 1 minute for wrap up. Thank you all for responding quickly. And those of you who sent in your questions, thank you for participating. We'll be in touch to make sure that you all get the answers that you need.
Yeah, thank you. And thank you, Ari. Thanks to Kimberly, Mike, Caitlin, and Nora for being part of this today, and for all of you for taking time to join us this afternoon. We appreciate your interest in this work. We appreciate everything you're doing in community, and we are excited for the opportunity to learn from all of you in the coming weeks and months through this process. We appreciated your patience and willingness to give us questions through the questions panel. You can continue to chat in there, ideas you might have for other ways we might share information about the foundation. We want to make sure that you stay tuned and informed as we continue to evolve through the combination. So feel free to give us tips besides the website and besides staff, other ways that we can make sure that information gets in front of you. And then know that the recording of this session and the handouts will be available on our website. They'll be posted very soon. You can look there for sharing the recording, for sharing the handouts, and then please use the Calendly links to book some time. We look forward to being able to have conversation with you. So again, thank you very much. Appreciate all of you joining us today, and hope you enjoy the rest of your afternoon. Bye-bye.